And then the last thing I'd say, which is ultimately, something to think about as we talk more about what Advocate Aurora Enterprises is this fundamental belief that while access to great care delivery is incredibly important to helping advance people's health, it is but one of many factors and actually in many cases is the least important factor in how healthy a person is. We came together, both organizations had health care in their name, and we took the word care out of what's now Advocate Aurora Health, not because we don't provide great care, but we said, if we're truly going to fulfill our purpose, which is to help people live well, we need to address the broader health of the people we serve.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. But I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say be solved if we have the will, the courage.
Today, we have the pleasure of being joined by Scott Powder, the president of Advocate Aurora Enterprises. AAE, which I think they call it, I'll take the liberty of calling it, it's as it's sometimes called, is the investment arm of Advocate Aurora, which is a health system rooted in the Midwest, covering about 26 hospitals, I understand 500 care sites, 75,000 employees, including 10,000 physician employees. Before taking on his role at Advocate Aurora Enterprises, Scott was the chief strategy officer at Advocate Aurora. That means he can speak with experience about healthcare strategy at the highest, most enterprise level, but he also really gets a lot of the challenges that early stage companies face. So, Scott, I'm excited to dig into all of that with you today. Welcome to this fireside chat.
Thanks. It's great to be here, Logan, and I appreciate everybody's attendance. Looking forward to the conversation.
Awesome. Yeah, we got a great group with us today. So Scott, let's start with a brief history lesson. So Advocate Aurora Health was the result of a merger, I think 4 or so years ago. And during that time, you were really leading strategy. So maybe you could pull back the curtain for us on that merger as a way of understanding Advocate Aurora and kind of what it's all about.
Sure. So as context, I've been with Advocate Aurora or predecessor organizations now for coming up on 28 years. As of next month, it'll be 28 years. So I was extremely young. I was an infant when I started. So, so the merger actually closed April 1st of 2018. So I guess a little over 3 years ago. And it was a merger of two relatively large at the time healthcare delivery systems, Advocate Healthcare in Illinois, which was where I came from, and Aurora Healthcare in Wisconsin, just north of the border. So we're sort of contiguous to each other, but operated in separate states and generally separate markets. And when we came together, just a couple things I would say about that. One is we came together because we have a belief in scale and the need for scale around efficiency. There's a huge body of literature around the correlation of scale and volume to better outcomes, particularly in surgical and procedural activity. So we thought there was a potential to advance quality by coming together. There's value to scale from a financial perspective. So we are, and one of the things that kind of makes Advocate Aurora relatively unique in the healthcare delivery space is our commitment to value-based care. So we have a huge portfolio of risk-based reimbursement, and scale is absolutely necessary and critical. We're in effect the third largest insurance company in the state of Illinois, and probably almost maybe the third or fourth in the state of Wisconsin, based on, even though we don't have a license, based on the amount of financial risk that we take. And as most of you know, if you're in the insurance business, the law of large numbers prevails. So scale is critical to managing volatility and managing risk. having balance sheet strength, et cetera. So we came together under, one, the belief of scale. The second reason we came together was this idea that we need to advance value-based care. We just believe philosophically that the fee-for-service system of care, which is what still finances somewhere depending on the market, 80 to 100% of all care, is a fundamentally flawed model. We also are not huge believers in upside risk sharing, like shared savings type of stuff. We believe the only way to really align incentives is for the provider to have financial skin in the game around managing the total cost and quality of care. So in order to do that, we believe that's part of what we wanted to do. And we had a lot of alignment around that. And then the last thing I'd say, which is ultimately, something to think about as we talk more about what Advocate Aurora Enterprises is this fundamental belief that while access to great care delivery is incredibly important to helping advance people's health, it is but one of many factors and actually in many cases is the least important factor in how healthy a person is. And we came together, both organizations had health care in their name, and we took the word care out of what's now Advocate Aurora Health, not because we don't provide great care, but we said, if we're truly going to fulfill our purpose, which is to help people live well, we need to address the broader health of the people we serve. Some of that is enabled by the fact that we have financial risk. So we have financial incentives to deal with things like wellness and preventative care and things of that nature. And we just believe that's the right thing to do. And so those are the reasons we came together. As Logan mentioned, I had been the chief strategy officer for Advocate Healthcare and helped work on the deal that led to Advocate Aurora Health. And until April 1st of this year was chief strategy officer. I recently stepped down to take on this role of leading Advocate Aurora Enterprises, which I know we'll talk more about.
Scott, before I jump into discussions about the enterprise side, the investment side, and get more technical, I just want to sit on one thing a minute. You said you've been there 28 years, and we talk a lot about long-term commitment and just the need to sort of raise your gaze beyond the next quarter. And I wonder if you could just speak to what you gained by being committed to something for 28 years. It's just not something that you hear a lot of in healthcare innovation.
Yeah, well, and I think it raises an interesting question. I don't have a great answer for it yet, which is how can you be in one organization and be so ingrained in that and still find a way to be innovative? And I'm not sure that I'm therefore, I certainly can't comment. You could certainly ask my boss whether he views me as innovative or not. But, I actually did an interview with a firm called Foresight Health. They publish like a weekly newsletter. And that was one of the questions they asked me is, how can you be an insider and be innovative? Don't you get sort of embroiled in the day-to-day and you sort of build a set of assumptions based on being in the same place for so long? How do you challenge those? And those are all good questions. So, and I don't have a great answer, but to your point about sort of stepping back, I mean, I remember when I first joined, what was actually pre-Advocate was a company called EHS Healthcare, which was the predecessor that merged with another in Chicago to create Advocate in 95. And I remember when I joined in 93, that's how long ago it was, I was in awe of all the people who had been there for 25 years. And like, I remember when Medicare first was started and when DRGs came out in, I think it was 1983, if I'm not mistaken. And now I'm that guy going, I remember when Bill and Hillary Clinton had healthcare reform, and like a bunch of the young people on my team were like, Bill Clinton was president? Yeah. So it's very interesting to have that long-term perspective. So the one thing I would say is, and I got asked this a lot as chief strategy officer, because my job was, and to some extent still is, sort of predicting the long-range future and trying to get our organization prepared for what are those trends that are, and how do we address those to be successful and fulfill our mission. And so my job was to always cry wolf. the world's going to end. Healthcare spending is unsustainable. It's all going to be managed care. All the doctors are going to be employed, et cetera, et cetera, et cetera. And every 3 years we update our strategic plan, or even every 5 years. And everyone would sort of look at me and said, yeah, Scott, you said the world was falling, and it ain't falling. So there is this, and what I've told people is the reason I actually think the world we're living in today is different. Now, you can debate the time frame for fundamental change and transformation of the healthcare system, but I think the thing I always say is that the landscape of people participating in our industry is very different than it was 5, 10, 15 years ago. And actually some of the people on this call and who are part of Startup Health, I think represent that. And I sort of, it's kind of bimodal. There's this whole group of what I call innovative, earlier stage. I don't want to say just startups, but certainly startups, earlier stage companies. There's massive amounts of capital that's flowing in to fund a lot of really interesting and innovative ideas. We're in an unprecedented time. 15 years ago, healthcare venture capital almost didn't even exist. And so to look at what we have today and the infrastructure of a Startup Health, and in Chicago, we have Matter and a variety of other organizations. So that's one fundamental difference, the amount of capital and the amount of innovation and activity and startup and early stage. The other is the other side of that bimodal equation, which is the mega scaled players, both on the technology side and in the care delivery and insurance and consumer health side, whether it's Google participating in healthcare, Apple participating in healthcare, Amazon clearly participating in healthcare, Aetna, CVS, United, Optum. These are $250 billion enterprises or more. As I said to someone, United, Optum generates more free cash flow in a year than we generate in revenue in a year and a half. So the amount of resources available to essentially transform care is just, and the players who are scaled to do it, coupled with that other end, the earlier stage and the capital going there, just to me means that there's no avoiding the transformation and the disruption in the industry. That's just my big picture take from 28 years of trying to do this. And I think this is finally the time it's going to happen.
Yeah. What I'm hearing you saying is that longevity in the industry, it can be a challenge in terms of staying innovative, and yet it gives you this really important perspective, which I know you're applying in a lot of different parts of your business. I think it's a good segue to Advocate Aurora Enterprises. Let's talk about why this came to be now. I mean, you kind of set it up just now, this being a unique moment in time, but what is it all about, and kind of what is your role there?
Yeah, so Advocate Aurora Enterprises grew out of this belief that sort of the germination of the belief was creating Advocate Aurora Health, that our purpose is to help people live well, which means not just providing great medical care, but ultimately providing access to a broader array of health services that, and recognizing that people are increasingly investing in their own health. I mean, while there's a $3 trillion healthcare economy tied to Medicare, Medicaid, and commercial carriers funding it, there's another $1 trillion economy around health where people are paying out of pocket to further their own personal health goals, whether it's your fitness club membership, how you shop for food, nutrition and supplements, exercise, sleep activities, mental resilience. There's a whole giant range of those things. And so what we sort of said is, if we're truly going to impact how people living well, we need to participate in that, what I call that consumer health and wellness ecosystem. 99.98% of our revenue is tied up in traditional healthcare delivery, doctor visits and surgeries and imaging studies, et cetera. And so if we're going to participate in that broader consumer health economy, which is very different, it's funded oftentimes out of pocket, although increasingly funded by health plans and employers, but it starts with sort of being an out-of-pocket, more retail-oriented industry. It's not an area that we necessarily had expertise in. So we said we need to create a separate division. that's what Advocate Aurora Enterprises is that separate division, built to, again, assemble a portfolio of consumer health and wellness products, services, and companies. And I'll just say that, because I get asked this all the time, so I'll kind of anticipate a question that might come up. Our job is not to simply serve the needs of our core care delivery system. And I acknowledge that we're a $13 billion healthcare system. We've been in the community in some cases for 150 years. So there's a lot of, it's sort of like Jupiter with all the moons around it. There's a lot of gravitational pull that Jupiter has, but, our goal is to be, someday be the Saturn, so that we are on equal footing and our own enterprise that will benefit the core, but we're sort of our own enterprise. And so in 25 years, I hope I look back and say we've created our version of what Optum has become within United Health Group. So that's sort of what we're trying to do in a nutshell. And again, the why now is, I will say part of the why now is also the underlying economics of care delivery. For any of you, and probably a lot of you have had some experience with, traditional healthcare, whether it's hospital or physicians or other outpatient, it's a terrible business to be in. It's low margin, it's capital intensive. There's no technology, almost any technology, that's putting more business into the hospitals. Almost all technology takes things out of the hospital. So our underlying utilization, despite the aging of the population and the increasing chronic disease burden, our underlying utilization of our core business is going down. Our costs are fundamentally going up and being exacerbated right now by workforce shortages, et cetera. A lot of our suppliers have monopolistic pricing power, whether they're pharmaceutical, drug, or device manufacturers. So we don't have a lot of control over our cost structure, and we have no control over our revenue. So part of this is also a, financial diversification play, as in addition to sort of fulfilling this broader purpose of helping people live well. So I'll stop there, but Logan, you can probe that in any way you want.
Yeah, what I want to know is really, what are your primary focuses of investment? I mean, where do you see this going when you could kind of focus anywhere?
Yeah, because a $1 trillion economy is too big. That's a giant ocean. So we have boiled this, our focus areas down to 3 for now. We're still, in some respects, we're also a startup. I mean, technically as a corporate entity, we're only about 8 months old under the name Advocate Aurora Enterprises. And in terms of having capital available from the parent company, we're only a year old, give or take. So we're sort of a startup. So which means that we're fluid, so things will evolve. But at this moment, we've picked 3 areas within that broader consumer health ecosystem to focus on. And the consistent theme across all 3 of these is, 1, large market with growing demand generally. 2, lots of unmet needs, whether they're gaps in services or just a fragmented environment, et cetera. And areas where we think we have some capabilities in our core business that can be brought over and assist Advocate Aurora Enterprises and the portfolio that's assembling to be successful competing in these particular sectors. So we've got 3. 1 is aging independently, obviously huge issue, huge unmet needs. All the economics say we've got a massive issue with senior care over the long term, lots of it moving into the home. And, we're a national leader in geriatric care. We're a national leader in Medicare Advantage in the core. So these are, we've got a lot of clinical backing and expertise. So we think we've got something there. Second area is parenthood. So it's never, and I've got 2 daughters. One is a rising senior in high school. The other actually just graduated from college. So, and even now I look at people on our team who are raising kids and saying it's like 10 times more complicated to raise a kid in 2021 than it was for me in 2001. And so huge unmet needs, lots of fragmentation. And again, we're a national leader in women's care. We have a nationally known children's hospital, got a lot of clinical depth in fertility and obstetrics and research. So we're thinking parenthood is an interesting place for us to participate. And then the third is what we call personal performance, which is sort of a catch-all, that the idea of aligning mind, body, and nutrition so that individuals can achieve their peak performance. And again, we bring a bunch of interesting capabilities. So one, lots of growth. I mean, the explosion, and any of you who are involved in digital mental health and behavioral health, valuations are crazy because everyone knows there's going to be huge growth. COVID, uncovered lots of issues with mental resilience and things of that nature. So, putting together a portfolio to address that and drawing on the capabilities, we have a, pretty well-known behavioral health service line. We have a lot of action in physical therapy and sports medicine and other aspects of exercise. We actually have a fitness business. That's part of that 0.02% of our revenue that's actually not pure care delivery. So again, lots of interesting capabilities that we want to bring to bear around aligning mind, body, nutrition. So those are the three focus areas at this moment.
Those are exciting areas. I mean, what I wrote down was just massive need, impact, and capability. You've identified just huge need. Where can we really move the needle? And then where do we also have some capability here and some pieces of the puzzle already in place?
Yeah, I think that's right. Maybe the one small thing I would say is because I mentioned this, we want to be fluid in this. So we took an ocean, and I'm from the Midwest. I grew up on the shores of Lake Erie and now live on the shores of Lake Michigan. So we boil it down to 3 large Great Lakes. That's still pretty big,
it is
fishing hole. These are going to evolve. I suspect some of these get crystallized and narrowed down even further a little bit over time, but that's where we're at today.
You've really laid it out nicely in terms of who you partner with and what that looks like. What advice would you give to startups who are looking and saying, maybe that's not me today, but I want to establish my business such that I'm going to be able to partner with a large health system like Advocate Aurora in the future? And I'm really setting myself up for success early. I mean, you did a lot of review of startups through Matter, I believe, and you've seen all those decks. So what are some words of wisdom you have about kind of setting things up right from the beginning?
Yeah, well, maybe what I'll do is tell you what's gone wrong, and maybe
Perfect.
these are usually failures, or at least snafus, or better lessons learned. Actually drawing on what we did, we're actually just wrapping up our 3rd health tech venture challenge that we do with Matter. And by the way, we'd welcome doing some of these things with Startup Health as well. And we're kind of one of the founding investors in Startup Health, so have a lot of respect for what Startup's been doing.
I didn't mention that, Scott, at the top of the hour, but I know it's been a fantastic working relationship, having Advocate Aurora as an investor and a partner all these years. So
and to give credit where credit's due, Aurora did the deal to invest in Startup Health before our merger, and I just inherited the relationship. I went to my first Startup Health festival, and right around the JP Morgan a couple years ago, and I was actually kind of shell shocked because there's thousands of people and lots going on. I'm like, I don't even know what to do. So I'm getting better at navigating that and I hope we come back together. But but this is just a lessons learned or things that didn't work well. So and some of this is just lessons learned on our end. So the company that that won our first health tech venture challenge, this is going back 3 or 4 years, really interesting company, and we liked what they were doing, and we started partnering with them. And then, like all good founders, and I'm learning this from kind of running my own startup now, they changed their strategic direction opportunistically, and therefore they were no longer interested in pursuing the things that we wanted to pursue with them because they had found a new opportunity. It was related, but it wasn't in our wheelhouse. So I think my lesson there is just, if you're still fluid with what you're trying to accomplish or the means by which you're going to achieve your growth and your vision, I think being upfront with the health system about that, and again, it is, I don't think health systems, we are not used to changing direction quickly. We're not used to changing direction generally at all. And so, we sort of felt like we got burned a little bit because these founders, by the way, the other thing is and I always tell people, try not to have a business whose main source of revenue is selling to health systems. Now, probably all of you have some aspect of that, but someone once said the sales cycle to get into a health system is typically longer than your Series A and B rounds. So it's just a very difficult process. So, but again, so one lesson learned, again, founders can be fluid and they should be, and that's part of being a startup, but that's not aligned with what big health systems are used to. And so that fluidity can be a challenge. I'd say one of the other things that, I think this has certainly been something like our job, we are a little bit, even though we're typically tax exempt, we are a little bit like for-profit companies who have to, who basically have to make earnings forecasts and live up to those. I have, my surprise, every single company that we've ever looked at investing in has a management presentation with, quadrupling of revenue in 2 years and then quintupling it in 3 and getting from, 3 million this year to 100 million in 3 years with, 30 million in EBITDA. And surprise, not one, there's 100% failure rate on that. So I don't really know what to do about that. There seems to be a general acceptance of completely, I guess, unbelievable management projections, and maybe the VCs are just used to that and they
What
sort
is
of
that,
weed through
Scott?
that.
Maybe you could unpack that for us. What is that? The desire for that overly confident expression, and yet the knowledge that you might be overreaching.
Yeah, well, I'd love to hear from the folks on this call. I mean, I think it's a competitive market for capital, and so you want to put, within some level of believability. And quite frankly, there's a buyer beware. That's why VCs are generally pretty good at diligence. And PE guys are probably even better at financial diligence. And that's one of the reasons we like to partner with institutional investors in certain cases, because we're not sure we're always the best at that. But so maybe that's just the name of the game. But I will tell you, at least for us, it's the challenge. And maybe this is insight as you think, down the road. The challenge for us is, we've got to, my job is not just strategic. That's the first and foremost thing, is to fulfill our strategy and our purpose. And that's why we're doing what we're doing. But if I only fulfill our strategic objectives and not our financial objectives, I'm a failure. If I've only fulfilled financial objectives, but not advanced strategic objectives, that's also a fail. And on the financial side, I need to be contributing to the financial health of a low margin, generally declining business, which means that I can't go out and invest in a bunch of companies that I'll say we're going to be at 100 million and tell my board, these guys tell us they're going to be at 100 million. And then every one of them fails to even come close to meeting expectations. Again, in a Wall Street world, you get punished by stock price, and that's what holds you accountable to sort of under promise and overperform. So that is an incredibly important, for me, seeing some credibility with management projections actually gives me comfort that we're talking to people who are willing to be reasonable and realistic and transparent about the state of their business.
It has been an honor to be a partner with Advocate Aurora these past few years. It's been really a pleasure to link arms in these various health moonshots that I know these folks on the call all care deeply about. And it's been great to get your wisdom today, Scott. 28 years, your long-term perspective on the health system, and now on Advocate Aurora Enterprises on health innovation and the startup landscape. So, Scott, thank you so much for taking the last hour with us and being so candid.
My pleasure. And I just commend all of you for the work you're doing and for your commitment to trying to improve health for the world and for our country. So thank you for what you do. And thanks to Startup Health as well. It's noble work that we're doing.